This healthy living tip is brought to you by the Christ Hospital.
Pulmonary hypertension is different from the kind of hypertension many people have. It's a high blood pressure in the blood vessels that perfuse the lungs. There are many different causes of pulmonary hypertension. In fact, there are 37 different conditions that can lead to pulmonary hypertension. Some of them include using diet pills. Many cases have no known cause at all, and it's called idiopathic pulmonary hypertension. The commonest cause is diseases of the left side of the heart. The main symptom of pulmonary hypertension is shortness of breath when a person tries to exert themselves. There are other rarer symptoms such as passing out or having chest discomfort. This condition is easy to diagnose if the physician is thinking about this condition. There are some simple screening tests that are non-invasive that can lead the physician to the diagnosis accurately. The main screening test is the Echocardiogram, which is an ultrasound examination of the heart, and it can determine the presence of enlargement of the right side of the heart, which is the main finding in pulmonary hypertension. The most important test to do is an invasive test called a right heart catheterization. It's an outpatient procedure. It's not very uncomfortable for the patient. It's done with local anesthesia, but without this right heart catheterization, really we cannot make an accurate diagnosis of the type of pulmonary hypertension that we're dealing with. It's a bad thing to delay therapy in pulmonary hypertension because it's a progressive disorder that is responsive to therapy, but will find more success in treating the condition if we treat it early. There are now 9 FDA-approved drugs for the treatment of pulmonary arterial hypertension, which is one of the forms of pulmonary hypertension, and many drugs under investigation, and we're involved in many of the trials investigating those new drugs. The first job of a physician treating pulmonary hypertension is to determine what type of pulmonary hypertension the patient has. There are 5 main categories, and the prognosis of the condition depends on which category the patient is in. So does the treatment. The treatment depends on which category of pulmonary hypertension we're talking about. I think it's important to remember that pulmonary hypertension is not one condition. Saying that someone has pulmonary hypertension is like saying they have a headache. You have to determine what the cause is before you can determine what the treatment is. Well, if you think you have this condition, I think the important thing is to get an ultrasound examination of the heart. And then the most important thing, I think, is to be referred to a physician who's familiar with the condition and its treatment. This is one of the few places in the United States that's really focused on pulmonary hypertension, its diagnosis, and its treatment. And I think it's important for patients who are suspected of having this condition to be referred to a center like ours. And I might add that pulmonary hypertension is much more common in women than in men. The ratio is something like 3 to 1. So if we have a woman who's experiencing unexplained shortness of breath, I think it's very important to consider pulmonary hypertension. We used to think that this was a disease only of young women, but as it turns out, the average age of the patient with pulmonary hypertension is 51 years. But it also exists in newborn children, in young children, adolescents. It's across the board. We have seen many patients who were extremely limited due to pulmonary hypertension with appropriate treatment come around to a very excellent quality of life. Well, here at Christ Hospital, we are fully equipped to deal with this problem. We have physicians who are specialized in the area and an entire staff of nurses who are very familiar with the condition and its treatment. So if you're an individual with unexplained shortness of breath with exertion, I think it's important to talk to your doctor about getting an ultrasound evaluation of the heart and possibly being referred for evaluation for possible pulmonary hypertension.
For more information or to schedule an appointment with a pulmonary hypertension physician, call 585-1000.